How are you? Hi, everybody. Um, to our panelists, a pleasure. Nice to meet you all. I'm Seth. Uh, if I pronounce any of your names incorrectly, please correct me immediately as we proceed with this. I think I got it. Feeling pretty good about it. And hello to our participants who are joining and trickling in. Thank you so much for joining us for the State of Care panel. So I'm going to introduce our panelists, and then we're going to get into it. And I just want to say off the bat, caregiving is changing rapidly from policy shifts to groundbreaking research. The way we support people living with dementia and their caregivers is evolving. But where do we stand right now? What is on the horizon? We have an incredible panel of experts to break down the latest in advancements in dementia research, care solutions policy, and give you an inside look at what's new in the world of care. And I'm going to do a brief introduction of our panelists. They all are so well acclaimed and established that I'm going to have to kind of abridge some of these bios a little bit. But Diane Tai is managing director of the Milken Institute for the Future of Aging, which advances healthy longevity and financial security. She leads the Future of Aging Strategic Direction Operations, including its signature program, the Alliance to Improve Dementia Care. She senior advisor at Georgetown University's Business for Impact at the McDonough School of Business. She previously led multiple consulting engagements in health and financial security, including founding the Aging Well Hub and Portion Balance Coalition. You've had
That's good.
I want to keep going. There's more good stuff here. Okay, Sarah Kremen, Dr. Sarah Kremen. Is that right? Am I saying it good? Great, perfect. Associate Professor of Neurology and Director of the Behavioral Neurology Program and Behavioral Neurology and Neuropsychiatry Fellowship at the Jonah Goldrich Center for Alzheimer's and Memory Disorders at Cedars-Sinai Medical Center. As well as many other amazing things. Dr. Kremen also leads clinical trials and observational studies focused on ADRD in the Goldrich Center. Dr. Zaldi Tan is the director of the Cedars-Sinai Memory and Healthy Aging Program and the medical director of the Goldrich Center for Alzheimer's Disease and Memory Disorders in the Cedars-Sinai Department of Neurology. Very long titles for all of you, and I like that. I like I like how many things get stacked in there. He has written for major medical journals, been covered by Wall Street Journal, New York Times, Los Angeles Times, Washington Post, CNN, Time, NPR. Overall, very impressive. Dr. Wen Dombrowski, nailed it. MD, MBA is a geriatrics physician executive who pioneered work at the intersection of aging and technology for over a decade, including the Dementia Ideal Care Map. A founding principle of Catalase, which is a cool name. She advised on new technology solutions and tech-enabled services and innovative care models in working with Fortune 500 companies, senior care healthcare providers, insurance payers, pharma, medical device companies, tech startup companies, and investors. Overall, a very impressive group of people. And now let's get into it. Diane, let's start with you. You lead the Alliance to Improve Dementia Care, bringing together over 130 organizations to drive change in dementia care policy and systems. Many family caregivers struggle to access financial support, paid leave, or even basic guidance on navigating the care system, which is very complicated, and some feel designed to keep people from interacting with it in an efficient way at times. So from your vantage point, what are the most urgent policy change needed right now to better support family caregivers?
Thanks, Seth, for having me join today, and to HFC for your support and membership in our Alliance to Improve Dementia Care. And congrats to your Taking Care film. We've been promoting it widely. I do want to do a shout out to Mike Brown, who recently joined my team to lead the Alliance. So, we see the person living with dementia and their primary caregiver, usually a family member, as this care dyad, as they're so closely intertwined in terms of care, access, and managed care. And to answer your question, you called out paid leave. That is number one on our priority list. The US is the only industrialized country in the world that does not have a national policy guaranteeing paid parental leave. And that doesn't even begin then to cover the care for an aging parent or another older adult loved one. So we have only 13 states right now in the US and Washington, D.C., who offer any kind of mandatory paid family and medical leave. It only covers 27% of the workforce. So imagine, in terms of the financial piece that you talked about, caregivers are spending about $7,200 annually in out-of-pocket expenses. For dementia caregivers, upwards of $12,000 a year annually. And if you end up transitioning your loved one to an institutional setting, we're talking tens of thousands of dollars. So this is an intense financial type of impact for caregivers. So I mentioned paid leave. Next on the list would be tax credits or stipends to alleviate any of these out-of-pocket expenses for family caregivers. And then third on the list, anything in terms of policies that can help working caregivers to recover losses in saving for their own retirement. So imagine you're reducing your hours, taking temporary leave, maybe leaving the workforce altogether. So there's this, you're losing on those employer contributions for your retirement. There's a concept called catch-up contribution. So for 401ks, it's like you can, after age 50, do a catch-up contribution. But why do we wait till we're 50? You could be in your 30s and 40s taking a few years out. They should be able to qualify for the catch-up contributions. And same with the Roth IRA, you can contribute up to $7,000 a year, but you have to have earned income or be married and have earned income. Again, why are we having these policies that are preventing people from saving? And then for people who might take family medical leave back, care, it's unpaid care for up to 12 weeks. You are not getting that employer match if you're lucky enough to have one. So you're kind of that double whammy. So anything we can do to protect working caregivers and their future financial security. That's where I'll start.
Thank you so much. Great answers. Dr. Kremen, you are a leading expert in dementia treatment and cognitive aging education. There's been a lot of news about new treatments for Alzheimer's and dementia the last few years. What is the most important thing family caregivers should understand about these treatments, and who are they actually right for?
Thank you. And thanks very much for inviting me. I'm very happy to be here today, and happy Valentine's Day, everybody. So it's true, in the past year and a half or two, you've probably heard there's been a lot of medications being splashed across the TV, new commercials talking about new treatments for Alzheimer's disease. They all focus on taking a protein called amyloid that's in the brain of people who have Alzheimer's disease. And these are basically designed to pull amyloid out of the brain. So this is very exciting because from a research point of view, we've never had anything like this before. And what makes it even more exciting is that when they looked at the brains of people and then looked at how did they actually do on cognitive tests in the trials, they actually did see that there was a slight difference between the people who got the drug and people who got a sham drug or placebo. So we've never seen that before in research. And so it was really exciting to see that there was some slowing of the cognitive decline and the functional decline that we see in people who have Alzheimer's disease. So who can get this medication? They've tested it in people who have what's called mild cognitive impairment. So that means people that have cognitive decline, but not functional decline. They're still able to do their daily living activities, and people who have very mild dementia. So cognitive difficulties and functional difficulties. So that's who it's for. It's not for people who are late stage. People who are earlier in the stage, people who have who are younger, maybe in their 70s, maybe 65. But it's not an easy thing to get because you have to have amyloid in your brain. So unlike some of the treatments you may have heard of before, like Aricept, memantine. Those we can give to people because they affect maybe the way the neurochemistry works or things like that, oxidative stress. But these medications, you have to have proof of amyloid, otherwise we can't give them. So when we're thinking of who's appropriate for this medication, we need to first establish that somebody has cognitive impairment, that it's not too late for them to get it because these medications are not for late stage dementia. So you need to go to a primary care doctor or a neurologist to get that diagnosis. And then the workup is the cognitive impairment due to Alzheimer's disease. So you need to get an amyloid test and see if you have that. And then there's other things along the way, like a brain MRI and some genetic testing. So it's very complex, and I don't want to take up too much time because we don't have much time. But in any case, there are things to consider because they take a lot of work. They're monthly infusions or infusions every 2 weeks. So there's a lot to be aware of in terms of these new medications. But they are exciting, and it's, we're on the cusp of new medications. It's really exciting about. Yeah.
Great. Thank you so much. That's a very helpful answer. Dr. Tan, you specialize in dementia, diagnostics, risk reduction. Early diagnosis is often emphasized, but in reality, many families don't receive a diagnosis until they're much later down the road with this stuff. So what are the biggest barriers as you see them with early diagnosis, and how can people overcome those barriers?
Great question, Seth. I think there are multiple reasons why, as a society, we tend to shy away from early diagnosis of a neurologic disease such as dementia. The first one is stigma, right? We are a society that celebrates youth and vitality and intelligence. And for some reason, some people equate having dementia as losing all of that, right? Losing your intelligence, losing your vitality, losing your youth. But we know that people who are in their 40s, 50s, which is certainly young people, can get memory problems. So it's really not an old age disease per se, but still there's a stigma. We have to recognize that that is part of the picture that we're dealing with. And that's why what you and Lauren are doing is so important, is to take away that stigma and normalize this condition as a disease that can affect anyone, and therefore deserves an early diagnosis. The second, I think, is ageism. So ageism is pervasive in our society. It's in popular media, and also this endless effort to chase youth. And again, because a lot of us think of dementia as an old age disease, we tend to run away from it, right? And when I say ageism, it's not just the lay people or the patients, but also primary doctors. I have a lot of patients who come to me and saying, I've been telling my primary doctor that I've been forgetful, and he said I'm just old. And it's ridiculous. It's disappointing, but we have a lot to do with our medical practitioners as well, to let them know that whenever someone says they're getting forgetful, there's been a change, or a family member says that, they have to take it seriously, right? Especially now that we have treatments available for this. And then finally, it's this fatalism. It's like, there's no cure. Why do I need to know? Well, there's no cure for cancer either, but I don't think anyone will tell us don't screen for cancer. The same thing with heart disease, right? But I think this kind of outdated way of thinking about dementia as, oh, it's like your hair is going to turn gray, you're going to get wrinkles, that's part of getting old. I think that really needs to go. That's a very outdated and really detrimental way of thinking about it. But I think this fatalism about that we can't do anything about it really needs to be reset, because there's a lot of treatments, a lot of exciting things going on in research, a lot of things that we can do about it, from care to prevention to disease modifying therapies. So I think this is time to really change the narrative for Alzheimer's disease.
Amazing. That's a great answer. And yes, it is. I think the stigma is something that I've personally seen a lot. And you see people just, and also just, I think, a general lack of interest in brain health, maybe from doctors in general, it seems, has been something that has kind of been a prevalent theme over the course of our time with this organization, kind of, like a lack of kind of interest or in brain health as like a subject almost at times, it seems, by the
I can tell you if I come in with a chest pain, nobody will say you're just old, right?
Exactly.
I'm forgetful. It'll be like, you're probably just old.
Yeah, you should deal with that. No, it's very strange. Dr. Dombrowski, you're an innovator in aging technology, developing tech-enabled care solutions while addressing AI ethics and accessibility in dementia care. Some not at all hot subjects there. Many caregivers feel overwhelmed by technology, or they worry it's just too expensive or difficult to access. What advice do you have to caregivers who want to explore new care solutions involving more modern technology, but they just don't even know where to start?
Great question. Well, thank you for inviting me to today's discussion. So, you've already mentioned I'm a geriatrics physician developing high-tech technologies, but a lot of people don't know that prior to becoming a physician more than 2 decades ago, I worked as a caregiver in senior living homes, in adult daycare. And so I really have what I would call a very practical, hands-on perspective of the day-to-day challenges of taking care of people. And because of that, I really think it's important to have solutions that are easy to use, solutions that are practical. So some tips that I would give to our listeners today is really just start by going to the stores, Best Buy, going to Costco, and just roam around the tech sections and look and feel and touch the things that are there. Even if you're not sure if you're ready to buy it or what to buy, but just actually go and see it, because sometimes things will make more sense after you've actually had a chance to play with it and see it. And the other suggestion is that if there's a senior center nearby, or actually a lot of local libraries now have a technology collection of things you can either play with at the library or things you can borrow. And so that's another way to, go to the community centers and see if there are things that you can use there, as well as ask if they have any support groups where you can meet with other caregivers and other people living with this condition to ask what are their tips. Because oftentimes it's really not necessarily about asking the experts what's best. Sometimes it's just asking your neighbor or asking this, a family that's in your town, like what worked well for them, and they can point you to the resources that are relevant in your community. And
what sorry, go ahead.
I was going to say the third thing I wanted to mention is very old school mail order catalogs. They still print these things where they print out these things that look like magazines with different gadgets and different solutions. And so that's a way to quickly be able to flip through hundreds of different options without having to go through very cumbersome websites. And I also want to just put in a plug for, even though I work a lot with high tech AI-based technologies, and there's a lot of great ones out there, I also think there's a big role for low-tech technologies, whether there's more simple electronics that can be helpful, like alarm clocks and whatnot, or pill reminders, but also things that don't have electronics, things that are physical gadgets, physical things that can help around the house. So.
And is there any, I mean, you don't have to say the brand of them, but is there any specific things that you feel are a good, if you just don't even know where to start and you're oh, what is a thing I could get that would maybe help me that is based in technology? What are is it camera? What are some of the actual devices?
Yeah, that's a great question. So I'm a big fan of voice activated devices. It can either be used by someone living with dementia or potentially a caregiver, because it doesn't require someone to be able to see a device, log into a device, and to be able to poke around to click. And I think this would be more appropriate in the earlier stages of care. There isn't as problems. And then also it can also be used for caregivers to set alarm, remind me to take my medications at 4:00, or call my daughter Sue, or there are different ways to speak at it, and it doesn't involve to use a phone per se.
I got you. Great.
Yeah. And I was just gonna say the other thing that I think is very practical is security cameras.
Oh,
So
yeah.
There's always been security cameras for many years, but what I've seen in recent years is very small, portable, and wire-free cameras where you don't have to like hire an electrician and rewire your whole house. You
Yeah.
can just buy it on Amazon and just stick it in a corner, and you can basically send that video to a phone. And so for any caregivers who aren't with their family member 24 hours a day, it just gives some peace of mind to both to everyone in the family, because there are ways where you can set up the device to alert you if there is movement or not movement. And it's just a way where the family members can have more freedom to be, going out for recreation or going out for work while still being able to keep an eye on their mom or dad.
That's great. That's a perfect specific information for people. Diane, back to you. Caregivers often struggle to navigate fragmented health and long-term care systems. Given your work at the Milken Institute, what innovative solutions have you seen that can make these systems easier to navigate for families? Is there anything that can help them with this kind of thing?
Yeah, no, it's so true how fragmented the care journey is. Before I answer that question, I just wanted to say something to build on what Dr. Tanzi said, which is I totally agree with the stigma, the ageism. But when you just think about it, you go to the doctor, they check your blood pressure, you pee in a cup, they check your hearing, your vision. They don't check your brain. They don't get a baseline of your cognition, which is kind of stunning when you think about how important this organ is. But anyway, I digress. In terms of some innovations, cross-sector solutions, I think one of the most exciting ones is the launch of the GUIDE model that happened in the summer of 2023. So GUIDE stands for Guiding and Improved Dementia Experience. It really helps people living with dementia remain in their home for as long as possible. The model requires the care navigator. So this is the person that helps really navigate between that health system and all the community-based resources that might be available, whether it's adult day or the respite care, food, transportation, and the like. So that's a really exciting development. Our Alliance actually wrote a paper all about this care navigator role. It also includes caregiver respite payment for that, first ever. And I know you guys do an incredible amount of respite care with HFC, which is also really cool, but then also caregiver training, 24/7 support. So what I love about the GUIDE model is it just recognizes that dementia is not just some medical intervention, but the majority of care is happening at home and in the community. And there's just so much help that's needed. So that's a cool innovation.
That's very cool. That should be very helpful to many people. Dr. Kremen, is there any research that you would describe as exciting in this moment to you? Is there anything that, from your perspective, is actually gives you optimism when it comes to all this?
I know, and there's so many things going on. It's hard to pick just one, but just to kind of give our viewers a little bit of like the lay of the land in terms of what's happening in terms of Alzheimer's disease research. And this is not even covering all the other things being done, say, for frontotemporal dementia or dementia with Lewy bodies, Parkinson's disease, which also, of course, have dementia components. But in the Alzheimer's world, as of 2024, there's about 164 clinical trials with 127 different drugs. So it's a huge landscape. Many of those are in phase 3. So that's like the closest stage to be then going to the FDA to getting approved, right? So the phase 3 studies are large studies with several thousand people that are really looking at the participants have the disease you're looking for. So they would have mild cognitive impairment or mild dementia. And some of these studies are even looking at people who are healthy people, don't have any cognitive difficulties, but we're trying to understand if we identify people earlier, right? And we give them a drug earlier, will that help? So just to also know that there's many different mechanisms. It's really interesting. So yes, there are drugs, that are targeting amyloid. There are also drugs that are targeting tau, the two main proteins that we see in Alzheimer's disease. But the really interesting thing and the challenging thing about Alzheimer's disease and other neurodegenerative diseases is it's not just proteins, right? There's inflammation, there's, poor metabolism, there's bioenergetics, there's difficulties going on between the neurons that, that's called synapses in between where the information is getting transferred from one neuron to the next neuron. So there's all these different things that are going on. And what's really lovely now is that there are so many studies that are now finally attacking all these different angles. So I would say that one thing else to know is that, we're all saying like, why is it taking so long? Why is it taking so long to get, drugs out there that will be effective? And partly it's because it's a really complex disease. It's really complex. And we're only starting to really understand how complex that is, and not just biologically complex, right? You have all these other things like environment and genetics and age and how far you went in school and what your diet is and whether you live next to a highway, which increases pollution. I mean, there's so many things that make it challenging. But on top of that, when you are in the lab, say, and you're testing things out, say, on mice or whatever, or in a dish, all the way to getting it to phase 3 to put it before the FDA, on average takes 13 years and sometimes longer. So though we are so needing these medications and these drugs, you can imagine it's a huge effort to try to get there. It does take time. But just to now just kind of switch a little bit and just say some of the things that are exciting. One of the things is I did mention there is a study called the AHEAD study where they actually are looking at people who are healthy, don't have any cognitive issues, have amyloid in their brain. They can tell that from doing a PET scan that can identify that protein in the brain. And they've randomized people to get a drug that lowers amyloid, lecanemab or Leqembi, which you probably have seen on TV, versus, a sham infusion. And it will go for a long time. It's at least 4 or 5 years. We won't have the readout for another couple of years, but what we're trying to understand is, can we change the arc? If we pull amyloid out of the brain of people, will that actually prevent some cognitive decline down the road? So that's a very exciting study that's happening right now, and we won't know the results for a couple of years. In terms of other people and other types of studies like that, there is at least one other study looking at the use of a diabetic drug, metformin, which some of you may have heard of, which works on changing sort of metabolism, and it lowers your insulin sensitivity. And it is also, they're using that in people who are at risk for having dementia. So we are moving things earlier and earlier. Meanwhile, there's a lot of exciting studies looking at inflammation, saying using inhaled insulin to try to reduce glucose levels and seeing if that boosts up your ability to think. Again, metformin we're looking at. And of course, a lot of people have probably heard, just like we're using the medications like Wegovy and other things for weight loss, but now we're also looking at them because they have anti-inflammatory properties and seeing if we can reduce inflammation in the brain and see if it'll help reduce the risk of developing dementia that way. So some of these drugs that we've heard of for weight loss and that would be used for everything, we'll know in a few years if those are also helpful to reduce the risk of cognitive decline. So I could go on, and I don't want to take up the time because there's so many medications to talk about, but it's an exciting landscape right now. So.
That's wonderful news for people. Dr. Tan, there's exciting things apparently happening with things like blood tests and more non-invasive diagnostic tools. What should families know about this, and when will they be accessible, I guess, on like a wide scale?
Well, a lot of it's accessible now, Seth. If you give me $150, I can tell you if from your blood whether you have amyloid in your brain. The question is, how accurate is it, and what are you going to do with the result, right? In the research realm, it's very helpful because, as Dr. Kremen said, there is the HEAD study that's looking at preclinical people who don't have symptoms of memory problem. And we know from research that it takes 10 to 20 years, up to 2 decades, that the amyloid and the tau is sitting in your brain before you develop the first memory symptom. So it gives us a huge, huge opportunity to intervene for prevention, for risk reduction. And that is where the field is going right now, is identifying people who have amyloid in their brains and see if whether clearing that amyloid and preventing tau from forming will prevent them from developing symptoms later on. So your question is about biomarkers. So blood-based biomarkers is probably the biggest news that have happened in the last I'd say 5 years. So for the longest time, memory clinics like the ones we have at Cedars have access to things like a spinal tap, where you get a sample of the cerebrospinal fluid, and we send it to the lab for analysis. We look at the levels of amyloid, tau, the ratios, and with a reasonable degree of certainty, we can say what's going on in the brain in terms of abnormal proteins that are developing there. Obviously, nobody wants to sign up for a spinal tap, but now the technology has advanced so much that we can get a blood sample and have, to a reasonable degree of certainty, say what's going on in the brain in terms of the abnormal proteins that have developed there. So that's a huge advance, because most people will be willing to get a blood sample and know whether they're starting to have amyloid or tau in their brain. And then, what's missing obviously is the treatment, because it's going to take a few years before we find out what things can we do for those people who already have amyloid in their brain, are kind of on that trajectory of developing Alzheimer's disease. But I think that's will be coming soon. The other thing worth mentioning in terms of non-invasive diagnostic testing is imaging, right? So amyloid PET scans are another new development in non-invasive testing for dementia. We also have tau scans as well, although not as clinically used widely as amyloid scans. So these new ways of detecting Alzheimer's disease before the memory starts is really a huge advance in our field, and I think will reshape the way we see Alzheimer's disease. As you know, for example, in diabetes, you don't have to wait for you to get heart disease or kidney failure or vision problems before you say, oh, I guess I have diabetes, right? What do they do in your primary care doctor? Like Diana said, you just get a sample of your urine or your blood, and the doctor tells you, guess what? You have diabetes. We have to start you on treatment right away. I think in the near future, we will see Alzheimer's disease as any chronic disease, where if detected early and instituting things like risk reduction, controlling risk factors, and then eventually effective medications to kind of slow down, or if not stop the disease. That is what I think we're looking at. And therefore, this early diagnosis that we've been talking about becomes even more important, because even with the available treatments that we have, the monoclonal antibodies, when you reach the moderate stage, you're no longer eligible for this. So that's why catching them early in the mild cognitive impairment and in the mild disease stage is really important right now. But I think in the future, catching people even earlier, before having memory problem, will be the key to really making huge strides in reducing the number of people who have this terrible, terrible disease.
Yeah, and I guess like you're saying, kind of that could also start kind of like within the medical community, because it isn't even common. I guess people shouldn't have to go to the doctor and be like, can you check my brain? Like, I think like the doctors should probably bring that up themselves and hopefully be leading that conversation. Because I think, again, like, to me, like, before I got into this whole organization, learning about all this stuff, I just assumed I assumed that they were checking on that stuff in some way, or it wouldn't be a problem. But it is strange that the revelation that is kind of most resounding to me over the last few years is that, like, it's not even something most people are looking at in any way, shape, or form.
The rate of diagnosis of dementia set is 50%. So 50% of those with Alzheimer's disease are diagnosed. And it takes, I can tell you, any hospital you walk through, there are people there who clearly have dementia. There's no trace of dementia diagnosis in their medical records. So I think it's partly because, again, we are, I think, in that tipping point now. And again, venues like this and the advocacy that you guys are doing is critical to this, because we have to break the stigma. We have to educate people that this is not acceptable, right? Just like it's not acceptable to miss cancer, heart disease, Parkinson's disease. It's not acceptable to just sweep dementia and memory problems under the rug. There's so many things that we can do together.
Yeah, it's very strange. We're about to wrap up. Anything any of you would like to leave us with? Dr. Wen? Yeah.
Yeah, I saw a comment from T about culturally appropriate services. So I just wanted to mention There is a field called ethnogeriatrics, which seeks to train healthcare professionals in culturally appropriate care. So that might be an interesting resource for T or other people on the call today. And then also, I've noticed increasingly in some towns, cities, there are some home care agencies that are targeting specific ethnic minority groups, such as more like Indian-based home care services or more like Asian-based home care services. So if you live in an area that has a critical mass of people, ask around and ask around for in your cultural organizations, whether they know of either agencies and organizations or at least individuals who can help. And the other thing I wanted to mention is that, so I've presented at several international dementia conferences, and what was really interesting for me is to see there are many resources from other countries. There are guidebooks, there are websites, apps that are made by other countries for people in countries, but it has really useful information about how to take care of grandma or what to eat or different tips like that. So try to, if you're looking for something that's specific to your background, and try to look in the countries for those types of resources. So that's all.
That's great advice. Anything else from anyone else that you'd like to leave us with before we head out? Well, thank you all so much for joining us. And thank you all for watching. We really appreciate it.